I remember the last time I spoke to you was something regarding the eye, right?
No, it's about alcohol.
Alcohol, yes. The last time we spoke was something regarding alcohol. So this time around is childhood cancer.
Yeah.
Why? Yeah, why focus now on childhood?
Okay, thank you. So basically, my research area is into maternal health and pediatrics. So we pick issues which are not really well, talked about. Then we highlight on them. So the main aim is awareness. Yeah. So each year we pick one pilot project. So this year the alcohol thing will be coming up. So we realize that this child cancer is not something we look at. So usually when you mention cancer, you don't see it in somebody who's below 13 years, but these things are happening. And unfortunately, in this part of the world, if you have cancer as a child, your chances of surviving is very, very low. It's below 15%, as low as 10%. So the only thing that can save your life is early detection. So that's why we chose this initiative.
All right, so what's going to be the plan for rolling out this initiative?
We began with self-awareness. It's important, especially in Ghana, because worldwide 80,000 deaths are recorded based on cancer-related diagnosis, and 400,000 diagnoses are also given worldwide. And as a mother, to see a child go through such pain is very devastating. Yes, so we started with self-awareness, and as time goes on, more information will be given on the programs.
So we are using these media outlets, and one thing we really leverage on is social media, which people can go on a social media platform is ISH concept. So just one word. So you go on Instagram or Twitter or Facebook, you just ISHCONCEPTS. So you can read a lot of health news, because people always care about health when they are sick. They don't see health as a problem. But if you always care, then you can prevent it. That's one thing.
You said that you did a lot of research within that particular area. Usually when people get cancer, older people get cancer, although we don't know the cause of cancer, but we can attribute certain factors, lifestyle issues and all of that. But with kids or a child as old as a year old, some months, what could really be wrong along the line there for them?
They are still kind of like purposive. They are still purporting. It's not so factual. I'm still trying to fit some puzzle somewhere. Yes. We are hoping there's this cancer group at Kolebu, and we are hoping that after this program we have to build that capacity as a country, take that bold step to further research. Because if you look at the pattern of the prevalence in the Western world and what happens here, they are very different. They are very different. Like the big cases here are not the big cases there, and ours is linked to certain epidemiological reasons, like certain viruses. They have the let's say the Hep virus, which is the Epstein-Barr virus, which we also have malaria in the hepatitis B, and where these diseases are common, they tend to have high cases of childhood cancers. But the exact reason, it's not well known. So I think we should take a bold step, not waiting for others to do their research and bring it. We should also try and take data over here and do biochemical analysis and understand these things.
We're not doing that.
We are not doing enough
at all.
We are not doing enough. It's all the research I've seen, we take it as in it's more of cross-sectional. It's more of cross-sectional. So within a particular time, let's say 5 years, they look at the cases, then they talk about it, and they they relate it to the literature which is already there. But we have to get a consistent way of drawing a plan for, let's say, next 20, 30 years, like what was done for coronavirus. Now we have the vaccine and all that. There's a consistent effort. If somebody has done a research in France, somebody has done a research here, then we collate everything, then we build that capacity to produce something new. So because the cases over here, if you are waiting for the Western world to come up with maybe a remedy or a therapy for cancer, it may be different over here.
Because the cases are different here.
Yes. That is the interesting part, bit of the child cancers. Yes.
Okay. One challenge with this whole child cancer thing, which he talked about, has got to do with early detection. But unfortunately for our situation here, sometimes the time they send the child to the hospital, it's been a very terrible, long time. What really amounts to some of these delays in parents even sending their child to the hospital? Most of them would like to go to churches and prayer camps and all that before they go to the hospital.
One of the reasons is because they are not well informed, and that's why we are here to let people know about childhood cancer. That is real, and when detected early, it can be cured. Yes. So as time goes on, we'll inform them of more programs.
All right. And before we move on further, today, what signs should parents look out for?
What signs?
Signs.
Okay. With
these are children, so and these are kids too.
Oh, okay, so it's actually everyday signs. Unfortunately, there are everyday signs which you always ignore, like common headache. There are ones. Some of them are a bit, let's say, odd, which can come to your mind, like certain bruises and let's say growth around the neck and the growth around the neck and the head area is one common sign. But everyday signs. But what they should look at for is the prolonged fever, prolonged more than 2 weeks, 3 weeks, 4 weeks, headache, fever. They should take their case.